Hi, everyone. My name is Joana Fernandez. I'm a current graduate student here at UCLA in Public Health and Social Welfare. I'm also an alum of Williams College and of Health Career Connection, an incredible summer internship program. And today I'm here with Jeff Oxendine, who is the founder of Health Career Connection. Jeff, would you like to share a little bit more about yourself today?
Sure, and thanks, Joanna. I really appreciate the opportunity to speak with you, and happy Public Health Week to everyone. I am the founder and CEO of Health Career Connection. I also I started Health Career Connection because I, as an undergraduate student, had a powerful internship experience that launched my public health career and changed my life. It helped me get into the field and find mentors and get prepared to graduate school and get a job and those kinds of things. And so I want people to have the opportunity to have the same experience that I did and become public health leaders doing the kind of work that they're really passionate about. I started HCC as I was a healthcare executive, which I did for 20 years as a hospital and physician group administrator. And then I made a big shift to come to Berkeley School of Public Health, where I was a faculty member and an associate dean of public health practice for 17 years. And now, in addition to leading HCC, I do health workforce and diversity work nationally. And my passion is really helping students pursue public health careers and choose the one that best suits them. And in fact, I even wrote a book we'll talk a little bit about later called You Don't Have to Be a Doctor to Discover, Achieve, and Enjoy Your Authentic Health Career.
Thank you so much for that introduction, Jeff. And I'm really looking forward to learning more about your experiences today and some tips that you have to share with students. So I know you shared a little bit about this already, but I'm kind of interested in how you initially, became interested in public health and what drove you to public health.
Well, at first I was really lost in my undergraduate education. I was actually even a PE major and I was an athlete, and I didn't grow up with very much exposure to what was possible. So I kind of stumbled onto public health. Fortunately, this school that I went to for undergraduate had a public health undergraduate major. And one day I came upon it and I realized that combined with my mother had sent me an article about hot health careers of the future, and hospital administrator was one of those things. And I had worked as a janitor in a hospital growing up and had a little bit of exposure to the hospital environment. So when I looked at public health, I realized that it was about things I really cared about social justice. It was about racial justice. It was about improving the health. What really drove me was improving the health of minority and underserved populations. I'm a Native American. My Indian tribe and my family suffer from a lot of health disparities. And then the community that I grew up with was a very diverse community that many people just didn't know was possible and didn't know how to access healthcare and didn't have health insurance and those kinds of things. So my passion was really to be somebody who made a difference in improving coverage and access to care and improving health outcomes for all people, particularly people from underserved backgrounds. So that's what drove me. And I was fortunate to discover that the health administration pathway was one that really suited me. I was focused on prevention, which is all about public health as well. But I realized that my talents would be more in managing and leading organizations to make sure that they had the policies and the programs and the approach to really engage with the community and design services that met the needs of the community and did a better job of providing quality care for all people. So that's kind of what my initial interest was as an undergrad. I mentioned the internship experience really that changed my life and helped me know this is what I wanted to do. It helped me believe that I could do it. And got me connected to jobs and to Berkeley, where I ended up going to graduate school, and so a lot came from that experience.
Thank you, Jeff. I definitely resonate with a lot of what you said, especially using those personal experiences to, help form some of our goals and interests within public health. But you definitely have a lot more working experience than I do, and so I'm kind of curious on what some of the lessons learned through your career path in public health are, if you have any that, on the top of your head that you can think of to share.
A few that I would would share, first of all, I think pursuing a path within public health, as well as the roles in different types of organizations and that align with your passions and your values. There's been times in my career where I have been really well aligned with what the organization did and what my role was my passions and values. And there are times when it wasn't. And I've also seen this with all thousands of students I've worked with, that the ones that seem to be the most successful and happiest are when they're doing the work aligned with their passions and values, and also with what their skills are and what they're good at. So I think that's an important lesson. And also being open to things that, to opportunities that may be different than what you want ultimately, and realizing that things will present themselves that will give you an opportunity to learn, to develop different skills and relationships, and maybe even income if that's important to you. In fact, for myself, I did some when I worked for a physician group that was a private physician group that wasn't necessarily aligned with serving the underserved. The experience that I got from that helped me have the knowledge, the skills, the credibility, and frankly, the income to be able to then make a shift to go more into working with underserved populations, and to take a big salary cut to go work at UC Berkeley to pursue the work that I really wanted to do. So had I not done that other work, I wouldn't have been able to do what I really wanted. So looking at everything and it was a very good opportunity that just presented itself. So being open, being focused, but yet open to what presents itself, and then making the most of each opportunity to get you where you want to go, I think is important. And then obviously working hard, doing a good job, and building relationships. Public health, success in public health and life in general is about building good relationships with mentors, with peers, with people coming behind you in the pipeline, and really utilizing those relationships in a mutually beneficial way for success.
Thank you, Jeff. I think that was a really good reminder for myself too, that sometimes our goals can be thought of as long-term, and it's okay if what we start off with isn't necessarily where we plan on ending up in our career. So that was really helpful to hear. Thank you. And I'm kind of wondering, it sounds like you eventually figured out that your path was more aligned with health management and leadership. What would you say other things that students can also do with a background in public health?
Well, one of the best things of all about public health is there's something in it for everyone. And the field is dynamic, it's changing. There's so much opportunity, particularly right now. And I actually used to teach a class called "What Can You Do with a Public Health Degree?" because there's so much that you can do. And whether it's health management and policy, I actually discovered policy a little bit later in my career, and realizing that, wow, in addition to managing organizations, if you work on health policy issues, you can affect thousands or millions of people. And so that's something that I encourage people to look into, even if you do another aspect, a technical aspect of public health. Being somebody who also works on policy or advocates for policy change is an important thing to do, because that's where we really get large scale fundamental change, in health, in payment, in diversity, and in equity, a lot of the things that we really care about. Obviously, we need more people who want to engage with community around really building trust and empowering community to improve their health. And that's something that people can do in public health, whether through health and social behavior or public nutrition, maternal health. Those are important areas, and health policy and management to work on. The whole issue of preparedness now is clearly it has been a huge issue, and not just infectious disease preparedness like we've learned with COVID, but also dealing with wildfires and earthquakes, and we're going to be dealing with water issues and all kinds of other things that hurricanes, so we need people to be able to go into that area, and then clearly working on infectious disease. And underlying all of this is the analytical tools with epidemiology and with biostatistics. And so if analytics data is going to drive public health going forward. So I think, find my whole advice is find what you're passionate about, and how that aligns with what you're good at and what you enjoy doing and your values and what the world needs. And then you can really make a powerful difference.
Thank you, Jeff. Yeah, it sounds like there's a lot of options to choose from and a lot of help is needed. So there's definitely a right fit for anyone interested in public health. And I know that you actually wrote a book about this recently, and you want to help students pursue health careers. I'm kind of curious if you'd like to share more about that. Maybe if you can share a little bit of insight on why you wrote the book, what some key highlights of the book are, how students can best use this book.
Well, my purpose that I figured out after all my years in the field is to help people discover and achieve what I call their authentic health career. And that's the one that really suits one's unique talents, passions, goals, lived experience, and what they really bring to the work, and to help people discover that and then achieve it and realize their full potential and the impact that they're supposed to have on health careers. So I did that. I've done that with thousands of students through Health Career Connection over 30 years and at UC Berkeley for many years. And then I just find that there's a lot of students that are still, they're passionate about public health. They really want to make a difference, or they're struggling to decide about being a doctor or not. And so I found that the 9-step model that I have in my book, called "You Don't Have to Be a Doctor to Discover and Achieve Your Authentic Health Career," is one that really helps people to hone in on what they really want, who they really are, and then how that maps onto the career options in public health or medicine that they want to be able to pursue, and then how to get there. It's a very practical book. It's not an academic book on how to network, how to find mentors, how to get a job, how to get into graduate school, all those things once you figure out what your path is. And there's a lot of tools to do that. So I've found that, this has helped thousands of people to do it. I know I've reinvented myself 4 times through using the tools in the book. And so, I think that it's the biggest win for all is if people can be happy doing what they really want to do, and they make the difference in health that we really need, and they become part of the public health workforce. And it's a more diverse health workforce in all respects, all of which are more critical and urgent than ever. So that's why I wrote the book. It's available on Amazon, and I encourage people to check it out. I'm really confident, whether you're an undergrad, a graduate student, a career changer, or somebody who's just looking for their next step in the health field.
Yeah, and I will agree with you because I have read your book. I read it last summer and it was really helpful, but I like that, just now you use the word reinvent yourself, because even now as a graduate student, having learned a little bit more, it's time for me to, I think, visit the book and kind of align some of my interests with like future career goals and take some time for that reflection. So I definitely recommend everyone interested in health careers to read it also. I think it worked really well for me.
Yeah, and it's really about navigating. So as we've learned through the pandemic, the world is going to be constantly changing and throwing things at us that we don't know. Plus, we at different stages of our lives, we want different things. And so the book helps you not only, it's not going to tell you, well, this is what you should do. It's going to say, here are some tools for you to figure out what you want now. And then when the world changes and your passions and preferences, life goals change, here's how you navigate to stay on path to have the life and the career that you want.
Yeah, exactly. That's great. Thanks so much, Jeff, for sharing about that. I know also, as the founder of HCC, what are some tips you have on how students can get connected to Health Career Connection?
So Health Career Connection is a national nonprofit. This is our 31st year, and we provide paid summer internships and a health equity scholars program, and support for our alumni, our 3,800 alumni, in 10 regions of the country, soon to be 11. We do this all throughout California, in New York, in Boston, in New England, in DC, North Carolina, where my Indian tribe is from, Tennessee, and then this year in Chicago and in Detroit, and virtual internships as well. So the deadline's passed to apply to HCC for this year, and we're actively trying to place the 3,100 students that applied for this year. But for next year, you can just go to healthcareers.org. And in the meantime, there are other resources there that are available. The applications will be out in the fall and will be available will probably be due in December or January. And I just encourage people to apply. And if you don't get accepted, oftentimes it doesn't mean it's not a reflection on you. It's solely a reflection on the number of opportunities that we had, because we don't have enough opportunities. So please reapply, because we really like it when people reapply, and we like it when people get accepted and have a great experience. So check out HCC at healthcareers.org. You can also check out my website, jeffoxendine.com, which has a lot of other resources to pursue your health career. It's got videos, it's got blogs, it's got workshops, a number of other kinds of things.
Thank you, Jeff. And it sounds like there's already a lot of alums that have gone through Health Career Connection. Can you speak about some of the benefits of going through the internship program? Maybe share a little bit about where all the alums have ended up in their public health work or health-related work.
Sure. So in the Health Career Connection, students get a paid full-time internship with a health organization, or they become part of our exciting virtual health equity scholars program and get to do team consulting projects with really innovative organizations. And then we have a comprehensive set of professional development, leadership development, career development workshops, and graduate school preparation. And we utilize my book to help people figure out what's the path that best suits them while they're in school. And we have accountability groups and things for people to help move forward on their action plans. And then afterwards, 60 to 70% of the interns extend their internship or get a job where they did their internship, or through the Health Career Connection Network. You become part of our HCC family throughout your career, so that you can continue to network with our 3,800 alums all around the country. And so you not only benefit during the program, but after the program with support to get jobs, go to graduate school, develop professionally. And examples of our alumni: Denise Fair is the Chief Public Health Officer for the city of Detroit. Turquoise Sibity is with the CDC Foundation and nationally leading their preparedness and response efforts. Ike Majay is the Chief Operating Officer of Long Beach Memorial Medical Center. Shelby DaCosta is the Chief Strategy Officer and President of the Affiliates Network for UCSF Health. So these are some examples of the kind. We have DL Poole is the Chief Operating Officer for Lifelong Community Health Centers, and Myrna Torsday is Chief Operating Officer for the Family Medical Centers in Chula Vista. So we have people that work in all aspects of public health, in governmental public health like Denise, in community health centers, working at the community level, in hospitals and health centers, in foundations. So the things that our alums do reflect the vast opportunities within the within the public health field. So it helps you get connected to all those different pathways. And we're increasingly partnering with now biotech and pharma companies, with digital health, with consulting, other kinds of organizations that are also playing key roles in addressing public health issues and health equity issues.
Wow, so it sounds like, HCC is really helpful for, as a foundation for leaders who are interested in doing a lot of diverse, different types of jobs. And we definitely do need a lot of leadership for current, challenges going on in the world and upcoming challenges. So I'm kind of curious to hear a little bit about what you think some of the issues in public health will be in the next 10 years or so.
Clearly, for a while yet, we're going to be dealing with the COVID-19 pandemic and working on mitigation and working on really then focusing on the recovery and setting ourselves up to prevent further damage from this and other infectious disease outbreaks. So there's a lot that people can do right now to get engaged in public health. Joanna's a contact tracer and now trains people to do contact tracing. And there's going to be a lot of roles in helping in the recovery, with people connecting people in the communities to social needs, to jobs, to things that are really to education, things that are really public health, the roots, the social determinants, of health. So I think a lot's going to go into that. There'll be a lot of lessons learned around the kind of data that's really needed to track, predict, reduce the spread of COVID and other types of infectious diseases that are coming. So I think that's going to be a lot of work over the next few years. We also have to address the other pandemics that have happened simultaneously. The systemic racism pandemic that's been ongoing for centuries now. As I think we've seen that it's because of it, we've had the impact of COVID on disproportionately on people of color, on people from low income backgrounds, and so I think it's time to address those issues, and that's part of public health. In doing that on a policy, on an institution by institution, on a program, and even an individual provider with patient or health educator with patient, level. And then clearly addressing health equity, doing the kind of things that are needed to address the social determinants of health, empower people to be able to have more equity, and then changing our policies and our practices, our programs, and what we invest in to be more equitable, and doing everything in public health through a health equity lens is going to be really critical. There's also going to be a continued need with the aging of our population to do more to help people age in place, in a healthy way in their homes, rather than becoming institutionalized, and to be able to have a better quality of life, and engage with their families and things that are really important to them. And I think not enough people in public health are focusing on the issues of dealing with the elderly population and healthy aging and end of life and those things. I think that's going to be important. Behavioral health, both mental health and substance use, are really important areas. They're not just being a provider, but in the whole aspects of reducing stigma, of addressing culturally appropriate ways for people to engage with the health system, language access around behavioral health kinds of issues. Those are all public health issues. And I just think overall, dealing with chronic disease, prevention and management, building healthy communities where people have the conditions to be healthier, and then utilizing data. I think data is going to be and technology are going to play more and more critical roles. So those are all things that are pathways that you can pursue to make a difference in public health going forward.
Wow, yeah, it sounds like there's a lot that needs to be done, and none of it is an easy task, but all hands on deck, and we can make progress towards fixing some of these issues. And I know that these problems are something that require a lot of leadership and a lot of people interested in helping, but I'm wondering if you can think of some qualities that students might need to have, or who might be interested in this type of work. What makes a good fit for this type of work?
I'm so glad you started by identifying leadership, because I think oftentimes students go into public health, and also faculty that are teaching in programs often sort of overlook the importance of leadership. The focus is often on technical skills, and technical skills are essential. Technical knowledge and skills are essential, and without it, you can't be an effective public health professional, and you need that competence to do a good job, particularly given the kind of thorny issues that we're going to have to deal with. And technical skills are necessary but not sufficient to really make change in public health. So I encourage everyone, regardless of your discipline, to develop leadership skills around being able to lead teams, lead projects, engage with community, be able to communicate in the most effective way, being self-aware, being able to be emotionally intelligent in your choices, being able to negotiate, being able to build partnerships with non-traditional partners in new ways. So being able to, and seeing yourself as leading from where you are, rather than waiting until you're the director of the health department. Lead from where you are, as a student, as an intern, as a family member, church member, a community member, those kind of things. So I think being a leader is essential. I think advocacy skills are essential, as I mentioned earlier, advocating for policy change and for the populations that you care about is going to be important. Being flexible and adaptable. What I'm hearing right now from health employers and public health employers is people need to be flexible, adaptable, and resilient, given and learn to deal with ambiguity, because that's a lot of what we're going to be working with, going forward. And then, being able to have good data skills. I think a lot of things, as I mentioned, are going to be data driven, and not only being able to understand how to analyze data, but what should be analyzed, how do we turn it into information, how do we visualize it, I think is an important thing, and make it something that people in the public and politicians and in all walks of life can fully utilize to make actionable decisions. And in the end of it, this is a people business. So I think being able to develop the ability to work effectively with others and with community, and bringing compassion and caring and empathy to it, along with a drive to make change. All those things are going to be qualities that will help people be successful.
Yeah, and I can definitely speak from my own experience that these qualities are something that we can continuously improve on also, and it's not necessarily something that everyone has right away, but we all have the time to try to build these new skills that you just mentioned to become better leaders. And I know you mentioned your book, and I know you mentioned Health Career Connection. I'm wondering if you have any other suggestions for resources, either to develop these skills or just to learn more about the field of public health. Any suggestions that you have for students?
The Association of Schools and Programs in Public Health is a tremendous resource through their website and through their public health jobs and the workshops, the book clubs, the listservs around career options, the resources around graduate school preparation. So ASPPH is a really good resource for students pursuing public health. One of my colleagues, Heather, oh my goodness, I'm blanking on her last name, from Columbia, the Dean of Career Services at Columbia, has a great book around public health careers that I highly recommend, and a great website. Sorry, I'm blanking on her last name. I think just getting engaged in the American Public Health Association, getting engaged with a professional association of that's related to your interests. And there are professional societies in health education, SOPHI, there's maternal child health. Within APHA, getting involved in student groups and also in these different caucuses around maternal child health or public health nutrition or others. Getting engaged in doing work in the community, learning by doing, because it's one thing to learn in the book, and you have to know that. It's another thing to learn by doing, and making sure that you're making time for networking through these professional associations and student clubs. Any chance you have to take on a leadership role within a student organization or within a committee within your school, particularly one around diversity and equity inclusion, or working with faculty on curriculum to make change. Get in, I think, look for any way to take initiative, to get involved, to show your leadership, step up to leadership, and then to build relationships, because in the end, that's really going to be what you do, and the relationships that you have and the passion that drives you will help you be the public health leader that you really want to be.
Thank you, Jeff. I know that I feel motivated and inspired by this conversation, and so I hope that everyone else who is tuning into this today also, found this really helpful. Those were all the questions that I had for today, but I just wanted to thank you for your time and for answering all of those questions. And, I hope that they're really helpful to anyone watching this. So thank you.
Thank you so much, Joana. And I really am grateful for being able to know and work with you as the amazing public health leader you are now, and that you are going to be going forward. And I look forward to working with everybody else to make a difference around public health and health equity. Thank you.
Thanks, Jeff.